So let's start with the physical signs. So what might I observe in someone's appearance that can indicate alcoholism?
The common symptoms that we see in people with alcohol problems is when we see somebody, even in their appearance, one can identify some of the issues. For example, their cheeks may be red, some of them may have shakes, some of them can be unsteady. Needless to say, people who are under the influence may behave differently and they can smell alcohol. In addition to that, they may notice a lot of physical complications, right from retching, abdominal pain, discomfort, confusion, giddiness, unsteadiness in their gait, all those things. Another common feature is something we in medical terms call as alcohol withdrawal, where when you try to cut down or stop your drinking abruptly without any proper medical assistance, you can develop certain symptoms. The common ones are people can develop shakes, especially in their arms. They can feel more anxious and agitated and sweating. In some complex cases, after this initial stage of withdrawal, if they don't get medical assistance, some people can throw fits, otherwise called seizures, and they can get into a very confused state where they can see things. We call it as visual hallucinations, and some people can get into a state called delirium, where they get confused, where they may not know where they are in terms of the time and place and person.
Are there any other indicators that someone's mood is being influenced by alcohol addiction? Are there any other ways?
The common mood disturbance that we see are anxiety-related problems as well as depression. Many people may not appreciate that alcohol itself is a depressant, or it can cause depression. So irritability, agitation, depression, feelings of guilt is a big problem. Mood swings, anger problems, all of those things. People may lose their confidence, impact on their self-worth, difficulty to stay focused and concentration, sleeplessness, poor appetite, negative feelings about self, about the surroundings and the future. And some people, when they feel severely depressed, can start feeling suicidal as well.
You've already mentioned some of the behavioural signs that someone's struggling with alcohol addiction. So are there any others, or what might my relationship look like with alcohol as someone with addiction?
When you try to expand other behaviors, in addition to the disturbances on your mood and your mental state, other behaviors we can broadly divide into two: self-destructive behaviors and behaviors that can be damaging others. Self-destructive behaviors as a consequence of alcohol, ranging from drink driving, when they lose the plot. People who are alcoholics may think that they are functioning well, whereas in fact they are not. So they may not say that, but people around them can say it. And the impact of that on others. For example, they get angry, irritable, ending up in violence. Domestic violence, say for example, is not very uncommon, unfortunately. So in terms of behaviors, in addition to mood disturbances and the psychological consequences one has to face, they have to face self-destructive behavior and the impact on people around them.
And in terms of social signs that someone's struggling with addiction, how may they behave in terms of with their friends and their family, or just loved ones in general?
Yeah. What I see commonly in people who unfortunately develop this problem is they go through various stages. Initial stages, commonly what we see is that they go through a stage of denial, where they don't say it, they don't accept that they may have a problem. We call it as a denial state. Then even after they realize they have a problem, since they are dependent on alcohol, they indulge in something called an alcohol-seeking behavior, where they may steal money, they may start telling lies, which again may be out of character for them. They may call off sick, and there is something called the Monday off sick syndrome, where they drink excessively during the weekend and unable to go to work on a Monday. So absenteeism may be usually in the initial half of the week, tendency to blame others, accusing others. For example, my partner is nagging me, that's why I'm drinking too much, or my employer is not supportive, that's why I'm not drinking. These are common things.
So many people might recognise these symptoms in themselves, but they don't necessarily have an addiction. They just might have a few of those symptoms. How do we know when someone's crossed that threshold into needing support and needing treatment?
It is difficult and interesting at the same time, because alcoholism, someone does not develop in one day. It's a very, very gradual, chronic, slow onset, slowly getting worse. So if I have alcohol problems, I may say I have been drinking since my late teens, initially with friends, then maybe alone. So it creeps up very slowly. And the sad thing about alcoholism is that even before I identify this as a problem, I may get addicted to alcohol. So it's not easy for me to identify, okay, until last month I did not have an alcohol problem, now I have an alcohol problem. Unfortunately, quite often people realize themselves that they have an alcohol problem when something bad happens in terms of relationship or work or accident or something like that. That is quite unfortunate. But the common things that in medical terms or in a psychological terms that we say is that their desire to cut down drinking, first of all, once they understand, and something called eye opener, where they have to have a drink first thing in the morning to deal with the withdrawal symptoms, guilt feelings, that sort of things. That is when somebody realizes that, okay, I have an alcohol problem or I am addicted to alcohol.
If someone watches this video and thinks, okay, maybe I have a problem, what are the next steps? What should they do next?
Once somebody accepts that I have a problem with alcohol, then we say half the job is done, because acceptance is one of the most difficult things. How to accept it is, if my alcohol drinking pattern or my consumption is having an impact on any domain of my life, whether it's my physical health, my finance, my family, my colleagues, my friends, reputation, whatever it is, that is when I realize and I accept, okay, I have an alcohol problem. So acceptance is the first step. Once I accept it, I would encourage people to discuss with others in a confidential manner. It can be a professional, it need not be a professional. You can go to your GP, or you can speak to your partners, your friends, your colleagues, your firm, anybody for that sake. My suggestion would be, one should not feel embarrassed, because you have to consider alcohol as a disease. It is not something that should be considered as an evil thing, or as something I have created, that sort of thing. Treat it as a disease, consider it as a disease, so that it will be easier for you to seek help. And once you accept it, since it is a disease, you have to seek help. So 3 things: one is acceptance, discussing with the people who you can trust, and seeking professional help.
If you found this video useful, please give it a like, and it allows us to spread this content as far as possible, getting it to those who need to see it. And for more of this content, please subscribe to the Priory YouTube channel. Thanks for watching.